If you hate all the Medicare spam you're getting right now and you just want someone to tell you what do I need to pay attention to and what can I ignore, this video is for you. Right now we're going through the biggest Medicare enrollment period of the year. It's the annual enrollment period, which is why all of those spammy calls and ads are clogging up your phone and your television right now. So let me show you 3 things that you must do during this time and 2 things that you can ignore without any worries. Okay, so I have broken this into 2 categories. We have the category of things you must do during annual enrollment period, things you can ignore during annual enrollment period. And the first thing that you must do during annual enrollment period is you must understand AEP, because you need to know what is happening, what you can do, what kind of changes you can make, when you can make those changes. And AEP stands for Annual Enrollment Period, AEP. Probably should put the period right, AEP. So first, when. When is AEP? Well, almost everyone knows this because it's all over television. October 15th to December 7th. That is annual enrollment period. During that time, you have to decide if you're going to make any changes to your Medicare plan and what changes those will be. But what can you do during that time? Well, let's do the what. During that time, you could move from a Medicare Advantage plan to another Medicare Advantage plan. Okay, most people know that. You got your Medicare Advantage plan, you're like, okay, I want to move from this company to that company, or within my company, I want to move from one plan to the other. Well, what else can you do during that time? Well, maybe you have a Medicare supplement. So another thing that you could do is you could move from your prescription drug plan, PDP, to another prescription drug plan. So that makes sense. If you have a Medicare Advantage plan, you could go to another Medicare Advantage plan. If you have a prescription drug plan, you could go to another prescription drug plan. Are there other things you can do? Well, yes, thank you for asking. You could say, I am going to go from a Medicare Advantage plan and I'm going to move to original Medicare, some people call it traditional Medicare, OMTM, whatever. So I'm going to go to Medicare and I'm going to add a prescription drug plan. So you could go from a Medicare Advantage plan back to original Medicare and take a prescription drug plan. Is there anything else you can do? Yes, there is. You could be on a Medicare supplement with a prescription drug plan, and you could say, I want to move from that to a Medicare Advantage plan. So you could do a lot of moving around. You could move from a Medicare Advantage plan to a prescription drug plan. And by the way, in this case, you would only do this if you were going to get a supplement and you were approved for that. I have lots of videos on that. You can watch those. But you can move between plans, Medicare Advantage, between prescription drug plans. You could go from Medicare Advantage to original Medicare. You could go from original Medicare with a Medicare supplement to a Medicare Advantage plan. So there's lots of things that you can do during this time. It's really important to understand them because what you do depends on what is important for you. Now, keep in mind, if you want to go from a Medicare Advantage plan to a Medicare supplement plan, you may have to go through a medical underwriting and qualify for that, so it's not quite as simple, but that's what we're here for. Depending on what it is that you want to do during that time, you can do it. But just at this point, we're trying to understand what can you do during annual enrollment period. Now, any changes that you make during annual enrollment period take effect on January 1st of the following year. So everything you're doing during this time is to prepare for 2026. But now you might be wondering, why would I want to switch my plan? What if I'm happy with my plan? So that brings me to my second thing that you must do during annual enrollment period. And the second thing that you must do every annual enrollment period is read your annual notice of changes, ANOC. We call it the ANOC letter. You need to read your annual notice of change letter, or ANOC for short. It is for people with a Medicare Advantage plan or with a prescription drug plan. So that means everybody pretty much. Because if you have a Medicare supplement, you have a prescription drug plan. If you have Medicare Advantage, then you also get one of these. So the deadline for this letter to reach you is September 30th. You should have already received it by the time you're watching this video. If you haven't gotten yours yet, you need to contact your agent or your insurance company for a copy because it's absolutely critical that you review this. So let me explain why it's so critical. You are going to receive any changes for both your Medicare Advantage plan and your prescription drug plan in this letter, and they can change their terms every single year. Even if you like the plan that you're in now, it doesn't mean that it's going to stay the same next year, because plans can make changes. They could increase their monthly costs, meaning premiums. Some plans maybe are $0 a month but are increasing slightly. Next year, 2026, there is some pressure on Medicare Advantage plans, so we could see some changes. They could increase your maximum out-of-pocket limit, which means that you could have to pay more if you have a lot of services. They could add or remove drugs from your formulary. That means the drug list that says which drugs are covered under your plan. And if you don't switch to another plan, you'd have to pay 100% for those meds or change to new meds. They could change their drug pricing. They could stop covering your medications. They could change how much you pay for your meds, even if your drug is still covered. And so there's a lot of things with medications that could change. They also can add or remove doctors, hospitals, and pharmacies from the network. We typically see this happen at the end of the year, but it can happen in the middle of the year too. And if your hospital or your doctor is removed from your plan's network, you have to pay full price to see them if you want to see them, or you have to go to another doctor now. So that's a really critical thing to consider. Also, plans can make changes to their extra benefits. Things like dental, vision, hearing care, as well as extra perks like telehealth, over-the-counter items, transportation benefits. All of those extra things can change, and we're seeing a lot of those that are changing for 2026 because of the pressure that insurance companies are under to reduce their spend. So your ANOC letter will show you all of the upcoming changes. And you might be shocked next year when your premiums go up, if your prescription drugs have changed or are no longer covered, or your doctor no longer is accepted in your favorite plans. So review those changes and make sure that if there's something you don't like, that you do something about it. And one last thing to be aware of with the ANOC letter. There are over 1 million people in the United States that are going to lose their Medicare Advantage plan in 2026 because their plan is just either going out of business or the insurance company is closing that plan altogether. And you would find that out in your annual notice of change letter. So absolutely number 2 is you've got to read your annual notice of change letter. The next question is, how do I actually find plans that are available in my area? And that leads to number 3. And number 3 is that you need to check plans. This is my shortened way of saying you need to review the plans that are available in your area because there may be one that's much better than the one that you have. Okay, I'm going to show you one way that you could look at plans that are available in your area, and I'll explain to you the good things about it as well as some of its shortcomings, and that is Medicare.gov. So if you go to Medicare.gov and you scroll down, you'll see that there's a place here that says Find Drug and Health Plans. You click on that. When you get to the next page, it's going to ask you, do you want to log in? If you have an account with Medicare.gov, you could log in and it will know some information about you. We're not going to do that. We're going to use the zip code of 68102, which is today we're doing Omaha, Nebraska, just because that sounded fun. It asks you what kind of plans you want to look at. Well, we're going to say we're going to look at Medicare Advantage plans and hit Find Plans. This will take us to see what type of Medicare Advantage plans are available in the area. It's going to ask if you have any extra help. And we're going to say here, no, I don't have Medicaid, I don't have SSI, etc. We'll just say I don't get help from any of these programs. That'll be most people, but if you do use one of those programs or you have extra help, then choose your level of extra help, right? Tell us your preferences. Do you want to look at medications? Today, in the interest of time, we're going to skip medications and just say we're not going to look at medications. But when we do this for someone, we always take medications into account because medications are a really critical part of choosing a plan. If you don't put your medications into a tool like this or the tools that we use, then you won't know if it's going to cover your medications. That can be the most expensive part of healthcare. Okay, now it's going to show us Medicare Advantage plans in Douglas. In this area, we can see that there are 28 plans. So look over here, 28 plans. So this is showing 10 out of 28. But guess what? This isn't even all of the plans that are available in the area. If we go over here and we say include special needs plans, and we say yes, because it actually looks like it's including them, but it's not. It was on no, we're kind of confusing there. If we say yes, it increases the plans to 39. Now, there are places in the country that have hundreds of plans available, but in this example, we get up to 39. Let's go back up. Let's just take the first one here, Aetna Medicare Smart Fit. How are you going to know what this plan covers? Now, you see, they've condensed and consolidated a lot of this, but unfortunately, it's not going to give you all of the plan details because, plans, they have an entire book, and we study the books for these plans. You can't really put that all on the internet. You say, okay, well, let's go, oh my heavens, this is so fun to use. Okay, let's go down a little more, and let's say, I want to see plan details. So I click on plan details. It's going to take me to more details about the plan, but it's still lacking a lot of information. And I'm not trying to overstress this point or drive it home too much, but if you click on the details, you can see things like how much the plan costs, how much it costs to see a primary care doctor. You can see monthly premium, health premium. It shows your standard Part B premium. That's what everybody, the $185 that everybody pays for Part B. It says you have a drug deductible of $590. It doesn't explain what that applies to, but in many cases that's only for the brand names. But it doesn't tell you. Maximum you'll pay for your health service is $4,000. So it has a $4,000 maximum out of pocket. And then it goes on and tells you more benefits like diagnostic tests. For diagnostic tests and procedures, $0 to $20. Well, that's okay, but which one is it? $0 or $20? Diagnostic radiology services like MRI, $0 to $175. So it gives you some information, but it doesn't really give you all of the details. And that's the limit of the Plan Finder tool on Medicare.gov, is that it's going to show you the major stuff. However, there are crucial details that are missing from the Plan Finder. For example, it doesn't even show you which doctors and which hospitals are part of the plan's network. That's one of the largest considerations. For us, the two major considerations are your medications and your doctors. And this doesn't even help you with your doctors. You'll have to call the plan and ask about their networks. You'll have to call your doctor and ask them which plans they take. It can be such a hassle. Also, Medicare's Plan Finder doesn't show you the plan's drug formulary. You can put your drugs in there and it will tell you if they're covered, but there's no place where it gives you the full list. Sure, it's nice to know if your drugs are covered, but don't you want to know what the full formulary is, what the full list of covered drugs is? Finally, it doesn't show you the extra benefits and how they work. It might give you a really high level of, yeah, this plan has some dental, vision, hearing, and sometimes they try to give you a little more detail as you get down here to the bottom. Go past drugs covered by tiers, extra benefits. It'll show you a little bit, but it doesn't really give you the real picture. Like it says, fluoride treatment, in-network, 0 copay, out-of-network, 50% coinsurance. What exactly does that mean? So it's a real challenge to get all the details that you want out of Medicare.gov. When you work with an insurance broker, a broker means someone who works with lots of companies, and that's us. We look at every insurance company. You work with someone who has access to all of the details about the plans in your area. You can discuss what you're looking for. You can look at your financial situation. You can give them a list of your doctors and the medications that you are taking. You can talk about the extra benefits that really matter to you. Is that dental really, really important, or the hearing or something else? They will filter through all of these options in your area and show you which plan checks the most boxes for you. And the best part is that working with a broker doesn't cost you anything. You are entitled to have a representative that's not part of the government, that's not part of an insurance company, and that way you have someone in your corner who will help you compare apples to apples and explain the fine print that will make sure that you don't miss out on the benefits that could help you to save money. And if you'd like to work with an independent broker, go ahead and call or text us at the number on your screen. Our team here at PlanFit is glad to help you. Okay, but now that we've talked about the 3 things that you need to know and do when it's AEP, or Annual Enrollment Period, now let's go back and let's talk about some things that you can ignore. I'm sure you've been waiting for this part, right? What can I ignore? Well, the first thing that you can ignore, and this is a real big one for me, is all of the spam calls. Don't answer your phone. And so many times people will call. I'm talking about these unscrupulous call centers, many of them overseas. They are going to call and pretend to be from Medicare. They'll say, this is, Joe from Senior Services. Senior Services? They're trying to act like they're from Medicare. And they're out in full force trying to get as many people as possible to respond. Some companies spend hundreds of thousands or even millions of dollars advertising on TV, trying to lure you in with promises of free groceries and flex cards and benefits and all of these perks. They just look so attractive, but I highly recommend putting the phone down, turn off the television, mute the ads. These ads oftentimes are just lying to you. Some people don't have the perks that they're talking about. Sometimes they take the benefits from one place in the country and advertise them all over. They've done that for years. Hopefully they've stopped by now. But don't talk to them. If they're calling you, they're wrong. No one should be calling you. You choose who you want to work with. That means you should choose to speak with someone that has your best interests in mind. Look at working with us, our virtual team, work with an independent broker in your area. Don't talk to a spam caller. I want to stress that the extra benefits that come with a plan, they can be very important. However, you should not choose a plan just because of extra benefits. Having low-cost health care, making sure that your doctor takes the plan at a good price, that your prescription drugs are covered, is so much more important than all of those perks that they're constantly bombarding you with. Also, a lot of these spam calls and ads, they don't explain to you that by signing up for their plan or for whatever they're talking about, you're changing your coverage. We have seen people that have called us and said, oh my goodness, I don't know what happened. I lost my coverage. I went to the doctor and they say they no longer take my insurance. And sometimes they say to us, what did you do? Unfortunately, we didn't do anything. Or fortunately, we didn't do anything. When you call one of those numbers that tells you, oh, you can get money back in your Social Security, some people have changed their plan thinking that that was about Social Security, not realizing it was about Medicare. Then when January rolled around, they were shocked to realize they had accidentally signed up for a plan that was worse for them. That's why, aside from your ANOC letter, it's okay to junk all of that other stuff, all that Medicare plan emails and phone calls and everything. Man, if those are coming through over and over, block the numbers. We had someone call us and say, my goodness, I am getting bombarded. I had 25 calls in a day. That's just inappropriate. I would say report them as spam because they should not be calling you. So absolutely ignore the spam calls. You're not missing anything. And if you think maybe you are, call us, call someone who's independent. We will tell you the truth. Don't rely on any of that spam garbage. Okay, another thing that you should ignore during this time, and I'll call this, this will be my second thing, is what we call captive agents. A captive agent is someone who works captive, meaning they are contained or controlled, captive to an insurance company. Because of this, they're going to do everything they can to get you to sign up for their company, even if it's not going to be a good fit for you. In fact, they probably won't even tell you or can't even tell you about other plan options. Instead, you should work with an independent agent who can represent many companies around you, if not all of the companies around you. So before working with someone, ask them if they're independent. If they aren't, stay away because they're not going to give you the full picture. So those are the 3 things that you must do, the 2 things that you can ignore. So get out there and get the best plan for you before the deadline of December 7th. And if you're not sure what you should do, if you should switch around from a Medicare supplement plan to a Medicare Advantage plan, or from a Medicare supplement plan over to a Medicare Advantage plan, then check out this next video where I do a deep dive comparison between the 2 options.